WNAX, it is the 2 o'clock hour on your big friend. And as often in the 2 o'clock hour, we talk with, let's just say, movers and shakers. And today we're talking with Brady Kerkman, Director of Development, Horizon Health. Brady, how are you doing today?
I am wonderful. Thank you for allowing me to come on today and talk a little bit.
Yeah, we're absolutely happy to have you. And, tell us about Horizon Health to start with here, Brady.
Well, we have a large footprint across South Dakota, from all the way down to Alcester, Elk Point, Martin, Mission, up to Isabel and Bison. So we really provide services, dental care, primary care, and as well behavioral health for those in need, from individuals that may not have insurance or situations where there just are not any other healthcare providers in the community.
Well, and let's face it, there's a lot of small communities that have trouble because they don't have a healthcare provider. I mean, it's not uncommon to travel 50, 60 miles to find a healthcare provider in South Dakota, is it?
That's absolutely correct. And we need to remember that these farming and rural ranches, they're integral to our communities and our well-being. I mean, we're a rural state, and we have to remember that, and we need to make sure that those farmers and ranchers get the care that they need.
Yeah, absolutely. It's very important that is the case. And, let's face it, Horizon Health trying to meet the need for a lot of those communities. And how do you go about meeting that need? I mean, it's not easy to put a health clinic in every community, right, Brady?
That's correct. We have 19 locations throughout South Dakota. Obviously, there's associated costs with that as well. We do receive some federal funding, and then obviously some private insurance, as well as Medicaid, Medicare, and then we have individuals who are uninsured altogether that we allow them to pay on a sliding pay scale. But keeping that all in mind, I mean, healthcare is expensive, and what we're here to do is be a staple in that community. And to be able to continue that, we really rely heavily on our very generous donors we have throughout the state.
Yeah, I imagine that is crucial. Where are you based out of, Brady?
The administration is based out of Howard, South Dakota, but like I said, we have many other locations throughout South Dakota.
Yeah, for sure. Do you find that when you provide health services in a community that they respond very positively to that?
I'm very new to the organization, but I will tell you this: in being able to visit with some of the patients, I have yet to hear anything negative about the services they receive. But like many other nonprofits, there's a lot of great causes out there. We're all competing for that dollar, unfortunately. But we know that it's important, and we really want to be true to that cause and serve not only the farmers and ranchers, but coming up here in October, we have Smiles for Miles, where we provide free dental care for children 0 to 5 during the month of October, and we do anywhere from 175 to 200 children throughout the year that we provide those services to.
Well, and those the dental services are very, very important in all communities, aren't they, Brady?
Absolutely. Here's the deal: if a child is not getting preventative care, they're potentially not going to school. If they're not going to school, that impacts them academically, socially. It impacts parents because they're being taken out of work to take their kids to dental services. So it's kind of that domino effect.
Yeah, it certainly is, and let's also face the domino effect, I think, and this is just a guess on my part, is the more accustomed we are to utilizing healthcare services in our communities, the more likely we are to use them. There's always a handful of people who avoid the doctor just because they've never been there, right?
Absolutely. There's a lot of great businesses in communities, but I always say our schools and our healthcare facilities, that's really important. If you want to bring a family back, you want to make sure that you have a good education for them. You want to make sure that there's employment. You want to make sure that there's health care in case of an emergency or situation. So they are true staples of our rooted communities.
Do you find that there are some communities that reach out and to you and say, hey, we think our community would be a wonderful place for you to serve?
Well, obviously that has occurred over the 50-some years of being in operation because, we have expanded greatly from where we first started many, many years ago. And so knowing that we're in 19 locations, that has happened multiple times.
Yeah, I would imagine that it has. Brady Kerkman, Director of Development with Horizon Health. And, of course, you have some new programs. You mentioned the program coming up in October. Well, that'll be starting tomorrow already, providing dental care for kids under a certain age. Are there other programs that you are beginning at Horizon Health as well?
Yep, I'm working with some key individuals in the Yankton community right now. We have, it's called our Pillar 2 in our Healthier Horizons program. And what that really means is we have a lot of patients that have diabetes or cardio heart issues. And unfortunately, if they're in rural communities or they don't have the resources, they don't manage that properly. And sometimes that can end up in emergency rooms, takes them off of work, takes them away from families. And so we really want to start this initiative of care packages that can allow them to kind of manage that stuff from home at a proactive, preventative approach. Obviously, then they're not going to emergency rooms. They're being able to stay at work and things of that nature. And so we're working with that in the Yankton community, working on a potential fundraiser and event coming up. Details are still in the early phases, but hope to share a little bit more of that in the coming weeks and months.
Yeah, sometimes, Brady, I will admit that I fail to consider those who have ongoing health problems that they must manage. And certainly the access to health facilities is very, very important in those circumstances, isn't it?
Absolutely. And, emergency rooms are great. And they serve a purpose, but we all know that we want people to get preventative health care and being able to educate them on how to manage that appropriately. And that's really what we're trying to do with these care packages. If we can implement this and secure around $40,000 to $50,000, we would be able to provide care packages to around 800 patients throughout South Dakota.
That's quite a bit of bang for the buck there, isn't it, Brady?
It is. When you really start to look at it, it's really pennies on the dollar.
Yeah, for sure it is. Brady Kerkman, Director of Development, Horizon Health. Brady, we appreciate you spending some time with us today, and we'll do this again in the future. How about that?
I look forward to it, and always a sincere thank you to our listeners and to our donors as well. And thank you to WNAX for sponsoring this.
Oh, you are more than welcome, Brady. Brady Kerkman, thanks so much for spending some time with us today. We'll do it again, Brady. Thank you.
Have a great day.
You bet.